Hi, thanks for joining me. I'm Corrie Brown. I'm a pathologist at the University of Georgia, and I'm going to be speaking about pathology of foreign animal diseases. I want to thank C.L. Davis for inviting me here. My background is that I was at USDA at Plum Island for 9 years before going to the University of Georgia. That adds up to a lot of showers, and we're going to review some of the diseases that are studied there. Let's go to the first slide. The world, she is a shrinking place. We're 6 billion people and growing. As Josh Lederberg, a Nobel laureate, said recently, exotic disease is an oxymoron. We're all interconnected in a very intricate and irreversible way. To think that our borders are secure and that a disease would never come in is foolhardy. In fact, our borders are very porous. U.S. agriculture is a huge part of the investment portfolio of our country. As you can see here, the figures show how much economics is dependent upon U.S. agriculture. And it's not just the farmers that would be hurt if a foreign animal disease entered. It's also the shipping industry, the packing plants, the loan officers, the runners on the commodity exchange. Well, what if a foreign animal disease entered our country? First of all, what are foreign animal diseases? The Office of International Epizootics, located in Paris, France, maintains regulatory information about animal diseases all over the globe. They've divided the diseases, big animal diseases, into List A and List B diseases. The List A diseases are those that are the most infectious, capable of very rapid spread, and would have major economic impact. These List A diseases contain some 20 different diseases, and the U.S. is free of almost all List A diseases. The presence of a List A disease in our country would seriously impact our trade and be economically devastating. If a disease were to come in and we didn't recognize it, we would be in a lot of trouble. So are we prepared? Or as this Gary Larson cartoon says, this is it, Jenkins, indisputable proof that the Ice Age caught these people completely off guard. I hope that we are very aware of foreign animal diseases, because the economic devastation that we'd suffer with a foreign animal disease is inversely proportional to the speed with which it is diagnosed. We're going to go over quite a few foreign animal diseases over the next hour or so. We're going to start out with all the vesicular diseases. Now, there are in fact 4 vesicular diseases that are recounted in all of the textbooks on animal diseases. Certainly, first and foremost among these is foot and mouth disease. And here's a definition which you can read. It's a highly contagious disease. It affects all cloven-hoofed animals. If we got it into the U.S., it would be very devastating economically. It's estimated that we would lose close to $30 billion in export losses when it was diagnosed. It's caused by a picornavirus, specifically a member of the genus Aphthovirus, and it affects all cloven-hoofed animals, including quite a few wild ruminants. It affects virtually all of our barnyard pals, as you can see here, and it's an extremely contagious disease. Pigs especially produce a tremendous amount of aerosol when they're infected, and it's estimated that each pig, as it expires, produces about 1 million viral particles per liter. 1 viral particle is all it takes to infect an animal, and then this is what we end up with, a salivating cow. In cattle, we usually see oral lesions first, whereas in pigs, we usually see the foot lesions first. It'll also cause tremendous vesicular eruptions all over the oral cavity, especially the tongue, so that when you pull the tongue out, sometimes all that's left in your hand is just a sleeve of epithelium. And in cattle, in pigs, it causes vesicles to form around the coronary band, and sometimes the entire claw just sloughs. It will also cause lesions on the teats, especially in nursing animals and those animals in estrus. And in young animals, it causes necrosis of the myocardium, and very young animals will die of myocardial necrosis. Sudden death. We studied the pathogenesis of this disease at Plum Island. We put cattle in an aerosol chamber and we exposed them to about the same amount of virus they would get as if they were in a room with an infected pig. We sacrificed animals at regular intervals to see where the virus was in the body. Very early on, we saw just this loosening of the stratum spinosum, and later on it would form a full-fledged vesicle. Looking at these tissues by in situ hybridization, the vesicles, of course, were loaded with virus. And so you can see how this particular vesicle would then rupture, leaving a totally denuded tongue. We wanted to know how it got to the epithelium, and we found that after inhalation, the virus was replicating in the respiratory bronchioles, replicates there, forms a high viremia, goes to the epithelial cells, replicates there, and causes necrosis. Control of foot and mouth disease is fraught with difficulties. It is the most contagious disease known to exist. The only way to control it is to slaughter those animals that are infected or exposed. Vaccination is used in some areas. However, vaccination is only a killed vaccine. It requires revaccinating every 6 months. It's a very expensive program to maintain. And any country who has the disease can't trade, so why even bother setting up the vaccination program? Just get rid of the disease. Where does foot and mouth disease occur today? It occurs throughout Africa, northern South America, all of Asia. Taiwan had been free of the disease until 1997. They'd been free of the disease since 1929, which is interestingly also the last time the U.S. had foot and mouth disease. Foot and mouth disease came into Taiwan. It came over to the west coast and soon spread into the pig rearing areas up and down the west coast of Taiwan. They had to kill 8 million pigs in order to control the disease. Hogs were the leading agricultural export, so it sent Taiwan into a recessional spin. Many animals had to be killed. It was an environmental nightmare getting rid of all of these hog carcasses. Foot and mouth disease is now a big problem in Mongolia. Japan had it earlier this year. They think they've eradicated it. South Korea had it. There seems to be new virulent types that are spreading very readily throughout Asia, causing big problems. On to the next vesicular disease, which is vesicular stomatitis. And we have a definition here. It's characterized by the formation of vesicles on the feet and in the mouth, just like foot and mouth disease. One of the differences with vesicular stomatitis is that it also affects horses. Vesicular stomatitis is caused by a rhabdovirus, specifically in the genus Vesiculovirus. And once again, here's the host range of vesicular stomatitis, the same animals that get foot and mouth disease, but in addition, we have horses included here. Transmission of vesicular stomatitis, we know that it's transmitted by direct contact because it will spread within groups of pigs quite readily. We know that insects take it around, but we're not sure about the reservoir. It's thought that rodents may be the reservoir of vesicular stomatitis. That is an area of active investigation. Here's the global distribution of vesicular stomatitis. This is a disease that's confined to this hemisphere. It's centered in Central America and makes periodic incursions north and south. We had the New Jersey serotype of vesicular stomatitis in the western United States in 1995. Then in 1997 we had the Indiana serotype also make an incursion up into the western states. It's unknown where these viruses were prior to them moving up into these areas, and it's suspected that there is an unknown reservoir somewhere. What does it look like? Well, hey, this looks just like foot and mouth disease, slobbering cow. The lesions, the oral lesions, are identical to foot and mouth disease. Similarly, here's a pig infected with vesicular stomatitis, big vesicle on the snout and a couple of vesicles forming on the coronary bands. Looks just like foot and mouth disease. The difference with vesicular stomatitis is that horses are also infected, and here's a vesicle on the lip of a horse infected with vesicular stomatitis. When this disease occurs, this is one of the few List A diseases that we have in the U.S. When it occurs, it causes severe problems, and it causes closing of lots of sale barns, transportation of animals, and the equine industry gets particularly upset. Our biggest worry about vesicular stomatitis, and our biggest reason for wanting to control it so drastically, is the concern that if we have an outbreak of vesicular stomatitis occurring, foot and mouth disease could slip in underneath it and go undetected. And that is a good segue into the next disease that we'll talk about, which is swine vesicular disease. So if you can keep in mind the idea about foot and mouth disease sneaking in behind another vesicular disease, we'll cover that. Swine vesicular disease, also a viral disease, and it's characterized by vesicles on the feet and in the mouth. Hey, that's just like the other two diseases we talked about. The difference with this one is that this is a disease of pigs and pigs only. Like foot and mouth disease, swine vesicular disease is caused by a picornavirus. In this case, the virus is a member of the genus Enterovirus. Once again, the host range is pigs and pigs only. This is not as contagious as foot and mouth disease is. Direct contact will spread it. The virus survives in feces for quite a while. One of the ways this disease has moved around the world is that it's fairly hardy within sausages and other cured meat products, and it will move around, then garbage feeding will cause it to cause a new outbreak in a new area. What does it look like? It looks just like foot and mouth disease, just like vesicular stomatitis, with vesicles forming on the snout and vesicles with eventual rupture forming on the feet. Now, I mentioned that most countries don't like to have swine vesicular disease because they might miss foot and mouth disease, and this is what happened in Taiwan. In Taiwan in 1997, they knew they had swine vesicular disease, and they thought they could diagnose it clinically without sending samples to the lab for confirmation. So when foot and mouth disease came into Taiwan, it was misdiagnosed for a while as swine vesicular disease. Foot and mouth disease is much more contagious and much more damaging from a trade point of view. So foot and mouth disease got well established. It slipped in under the cover of swine vesicular disease and ruined the pig industry in Taiwan. On to the last vesicular disease, which may be a disease of historical interest only. This is vesicular exanthema of swine, and the textbooks still refer to this as one of the classic 4 vesicular diseases. Vesicular exanthema of swine, once again, is characterized by vesicles on the feet and in the mouth, just like the others. It's a disease of swine, and it is in the family Reoviridae. The host for this disease are pigs. Now, the reason we have pinnipeds and fish here with question marks is that vesicular exanthema of swine arose in the 1940s. It happened first in pigs in California, some pigs that were fed fish material. Somehow a virus from the fish material, because it's believed that these calicivirus, similar calicivirus, circulate in pinnipeds and fish, marine caliciviruses. This calicivirus somehow got into pigs, became adapted for the pigs, spread among the pigs, and spread all over the U.S. It was eradicated in 1953. So chances are the only place that vesicular exanthema of swine exists now is in someone's freezer. And the probability of it coming back will only happen if these materials are again fed to pigs and the virus again makes an adaptation and circulates. We do see a similar disease, San Miguel sea lion virus, present in pinnipeds on the western coast of the United States. So once again, the transmission, once it gets adapted, it goes pig-to-pig contact, but it probably started out by giving infected fish to pigs. What does it look like? These are all experimental inoculations. Remember, this disease does not occur in nature anymore. Vesicles on the snout and the same kinds of lesions on the feet. So just to wrap up these vesicular diseases, and I've used some art slides all the way through this, these vesicular diseases are all diseases of stratified squamous epithelium. This is a painting by Georgia O'Keeffe that I think is strongly reminiscent of stratified squamous epithelium. And with all of the vesicular diseases, somehow the virus comes into the epithelium, probably through Langerhans cells, gets spread among adjacent epithelium, causes necrosis of vesicle, forms vesicle ruptures, and you end up with a rupture. In all of these diseases, it seems to be the stratified squamous epithelium that is the most active that is affected. So in cattle, which have a very active tongue and they're eating a lot of roughage, you see the vesicles on the tongue first. Whereas in pigs, which have this big body weight on the teeny tiny little feet, you see the lesions at the coronary band first. We see teat lesions in animals that are nursing or are in estrus. The next set of diseases that we'll cover are those that cause mucosal problems, the mucosal diseases, and we'll go over rinderpest, peste de petite ruminants, and malignant catarrhal fever. To deal with rinderpest first. Rinderpest is a disease of great historical importance. The first veterinary schools, both in Europe and Africa, were formed as a result of responses to massive epidemics of rinderpest in those areas. The first time a clinical thermometer was ever used to monitor disease was for rinderpest. The first tissue culture vaccine ever made was made in 1951 for any disease, either animal or human, was made by Walter Plowright in 1951. It's a modified live vaccine which is still, in modified form, still used today. One tissue culture infective dose will protect an animal for life. Rinderpest often follows in the wake of military campaigns. We've seen this historically. We've seen it in recent times as well. The Kurds fleeing Iraq after the Gulf War took rinderpest to Turkey with them and engendered an epizootic of rinderpest in Turkey, such that the European community sent 1,000 teams of vaccinators in to vaccinate the entire national herd. In addition, the OIE, the International Office of Epizootics, was formed in response to rinderpest. After World War I, Germany was ordered to pay reparations. They sent cattle as part of the payment to a facility in Belgium. From the facility in Belgium, cattle were distributed to many countries in Europe. Unfortunately, rinderpest was incubating at that facility. Rinderpest got spread all over Europe. In response to that, Europe decided to form the OIE. Here's a definition of rinderpest. What we usually see are oral erosions and bloody diarrhea. This is a diarrhea disease. It's caused by a morbillivirus. It affects cattle and all wild ruminants, and it's contact that's responsible for transmission. There is a saying among people who work with rinderpest in developing countries, if you have good fences, you won't have rinderpest. It does require contact. The clinical disease incubation period is short, and then the clinical disease we refer to as the 4 Ds: depression, diarrhea, dehydration, and death. In addition, some animals have a conjunctivitis that is not unlike that seen with canine distemper, another morbillivirus. These animals are very ill. They are down and out. They're dehydrating out their hind end. They have a conjunctivitis, as I mentioned, not unlike canine distemper, and if you were to take a swab of that conjunctiva, you'd probably see morbillivirus inclusions. The diarrhea has something for everybody in it: mucus, blood, fibrin, very watery. It can be a shooting diarrhea. Here's a section of the colon with the exudate on it. Lots of fibrin, some mucus, some blood. And sometimes it's very extensive. And here's the proximal colonic patch, and there's just a big diphtheritic membrane present here. To look at it histologically, this is a section of eyelid. And here we can see there are some syncytial giant cells forming. And a closer look of a section like this shows the nice syncytial cells, which are so characteristic of these morbilliviruses, and some necrosis on the surface. A little later, it would look like this with erosion, ulceration of the epithelial surface. By in situ hybridization, we see that there are clusters of cells infected, and once again, it's probably the Langerhans cells that are taking the virus in here, passing it off to epithelial cells, which is why we see this diffuse segmental pattern of infection. In the gut, it causes necrosis of both crypt and villus cells, and here we have a lot of crypts that are absent, and in the remaining crypts they're struggling to cover the area. By immunohistochemistry, they're staining in both the crypt and the villus levels. The lymph nodes, the lymphoid tissues, completely collapsed. Here's a section of mesenteric lymph node, and there's just nobody home. All the lymphocytes have dropped out. They're all necrotic or apoptotic. By immunohistochemistry, we don't see a lot of staining in the lymphocytes, but we see a lot of staining in the macrophages. This virus infects macrophages and affects the lymphocytes secondarily, either through cytokines or lack of a supportive network. Now, this is a morbillivirus, so it helps to think comparatively. If you think of canine distemper, there is a gut infection, which is often not noticed clinically, and then you get the pneumonia with infection of the bronchioles. With rinderpest, although the animals are dying of the diarrhea disease, in fact, there is infection of the bronchiolar epithelium, and those that survive often go on to develop a pneumonia, although the survival rate is fairly low. To control rinderpest, slaughter and quarantine are very useful, and once again, the vaccine is so effective. Rinderpest is a disease that the Food and Agriculture Organization, the FAO, has decided that this is a disease that could be eradicated by the year 2010. They are moving through Africa with their eradication campaign. There are few remaining reservoirs of infection. Some of them are in areas that are difficult to reach because of civil strife. This includes southern Sudan, Somalia, Pakistan, northern Iraq. But it is believed that with a concerted effort, rinderpest can be a disease which will be eradicated from the world by the year 2010. This is a series of artwork of cattle, and I find it interesting that so many people who work with cattle paint them from the butt end. So here is a painting by Degas. We all know Degas from his pictures of ballerinas. Here he's done the equally graceful thing with a cow. Van Gogh, once again, from the hind end, and Edward Hopper. And this is a fitting series of slides to talk about a diarrheal disease of cows. From here, we'll move into rinderpest's cousin, which is peste de petits ruminants, or rinderpest of sheep and goats. This disease is of sheep and goats, and it's characterized by the same kind of diarrhea that we see in rinderpest, oral erosions, as we see in rinderpest, and also these animals get pneumonia. This is also a morbillivirus, transmission by contact, very similar to rinderpest. This is a disease like rinderpest in that they're the 4 Ds plus a P. Depression, diarrhea, dehydration, death. These animals also develop pneumonia. Here's a goat infected with PPR. The goat is quite depressed, very dehydrated because it's dehydrating out the hind end, perineal diarrheal staining. Unlike rinderpest, PPR causes a lot of crusting to occur along the conjunctiva and the nares. There's abundant virus there replicating, causing erosions. Stomatitis can be very severe. Here's an example of extensive ulcerative stomatitis in the oral cavity of a goat. If you were to take your postmortem knife and scrape along there, all of this would come off. It's all necrotic epithelium. They do also get diarrhea, and here's the open cecum showing a pronounced reddening and some debris on the surface. Now the animals may survive the diarrhea episode and go on to develop a full-fledged primary viral pneumonia. Peste de petite ruminants is endemic in Africa. It was first described in the Ivory Coast in 1940. Since then, it's been detected all through the equatorial belt of Africa. It's present in the Middle East. It caused problems in Israel a few years ago, and it's now been detected over as far as India. I believe it is a spreading disease, but also improved methods of diagnosis are allowing us to find it in more places. And this is a picture that Howard Gobble of the AFIP gave me. It's from Djibouti, showing a herd of goats affected with PPR. Histologically, the disease has a lot of characteristic lesions. Here's a bronchiolitis, necrosis of bronchiolar epithelium, and the formation of syncytial cells with intranuclear inclusions. Very characteristic of PPR. Also characteristic of PPR is that once the virus has done its damage, bacteria move in quickly and you get a secondary bacterial pneumonia. By immunohistochemistry, it is the epithelium of the bronchioles that's infected, and it spreads out into the alveoli. So this is a bronchointerstitial pneumonia. Histologically in the gut, very much like rinderpest, with loss of crypts, tremendous villus atrophy, loss of fluids through the guts. Immunohistochemical staining in both the crypt and villus level. How to control PPR? PPR is controlled through the slaughter of animals and also through vaccination. The vaccine for rinderpest works very well to control PPR. This is a painting by Marc Chagall, The Eye and the Village, demonstrating a goat and the central role the goat plays in village life. Our third mucosal disease is malignant catarrhal fever. For a definition of malignant catarrhal fever, this is not a contagious disease. It's a sporadic disease. Very high mortality. Affects multiple systems in cattle, will also affect deer. And the lesions that we see are usually lymphoid proliferation in many places and epithelial erosions. Now, there are considered to be two forms of malignant catarrhal fever. These forms look identical clinically and pathologically. This first form is associated with wildebeest. Wildebeest are not affected clinically by the form, but they carry the virus, and the virus is called L-salafini herpes virus 1. Now, when cattle contact wildebeest calves who shed the virus, they come down with malignant catarrhal fever. In adult wildebeest, it's not thought that they shed the virus, so it's only contact with the calves that will cause cattle to come down with the disease. The other form is called the sheep-associated form, or the endemic form, and this occurs worldwide. The epidemiology is very similar. That is, it's believed sheep have a virus that does not affect adult sheep, and in lambs there's a period where they shed the virus before it becomes unavailable for other animals. So cattle get this disease when they have contact with lambing sheep. Now, this L-salafini herpes virus is considered to be exotic. However, we have a lot of wildebeest here in the U.S., both on private farms and also in all of our zoos, and we do see this form cropping up periodically in the U.S. Now, there is a third form that has been discovered recently. It has no name yet. It was described in the Journal of Clinical Microbiology earlier this year. Using degenerate primers, they looked at some deer from a zoo, a petting zoo, that came down with a disease that looked like malignant catarrhal fever. Using these degenerate primers, they found that it was not ovine herpes virus 2, it was not L-salafini herpes virus 1, but it was a new virus. It has no name yet because they don't know the reservoir. All of these viruses are part of the gamma herpes virus, and all of these gamma herpes viruses are highly cell-associated. Some of them are associated with lymphoproliferative disease. So to give you some examples of gamma herpes viruses, we have Epstein-Barr virus, we have herpes virus Cymeri, and both of those viruses will cause lymphoproliferative disease. Also, Marek's disease. We see malignant catarrhal fever in cattle, and we also see it in deer. And as mentioned previously, sheep and wildebeest are not affected clinically. Also, the disease in deer is somewhat different from the disease that's seen in bovine animals. Often this is more of a hemorrhagic illness, and the lymphoproliferation is noted histologically, but not grossly. Once again, this is the transmission. The cell-free virus, before it becomes cell-associated and unavailable for other animals, is only present in the wildebeest calves and the lambs. And there's what a wildebeest looks like. What do we see with this disease clinically in cattle? We'll go over all of these clinical signs and the pathologic lesions. Often the first thing we see is a snotty nose, mucus coming out of the external nares. Now this disease has been well described in South Africa, where it's referred to as snotziekte, which means snotting sickness. And this can become very severe, lots of mucus pouring out. The animals tend to develop a corneal opacity, which starts at the periphery and moves centrally. Now this can be somewhat confusing because an awful lot of cattle have had an episode of pink eye at some point in their past. Then when this corneal edema with malignant catarrhal fever starts, it starts on the periphery, but because there's previous damage in the central area from the pink eye, often that flares up as well. Very large lymph nodes, up to 10 times normal size. And these animals become emaciated. They have stertorous respiration. They have tremendous rhinitis. You can hear them breathing far away. They have corneal opacity, photophobia. Here's a picture of a zebu cow in Africa infected with malignant catarrhal fever. It's emaciated. It has photophobia and a conjunctival discharge. Let's look at what we see pathologically. The corneal edema, we saw that clinically. Oral erosions, it starts with a reddening of the buccal papillae. The ends of the papillae become necrotic and blunted. In the nasal cavity, all of the damage is concentrated in the anterior third of the nasal cavity. And we'll come back to why that is. The damage here in the buccal mucosa is made of groups of lymphocytes that are attacking host. Lymph nodes are very large. So to go back to the pathogenesis of this disease, malignant catarrhal fever is a virus that infects a subset of lymphocytes known as large granular lymphocytes. These lymphocytes then proliferate in a pseudo-neoplastic way. So you have lymphoid expansion everywhere. These lymphocytes also then attack host. And we get what looks like a graft versus host response. They attack stratified squamous epithelium, which is why we have damage in the buccal papillae. Only in the anterior third of the nasal cavity, because this is the only place that has stratified squamous epithelium. This is cuboidal or transitional here. Here they are, the lymphocytes are attacking hosts, so sort of a lichenoid infiltrate moving in to damage the epithelium. Lymph nodes could look just like lymphosarcoma. Tonsils, tremendously expanded, looks like lymphosarcoma. Spleen, this real cobblestone effect, tremendous pseudo-neoplastic proliferation of the lymphocytes that are bent on attacking host. Peyer's patch, hyperplasia of Peyer's patch is seen. We also see multifocal infarction, and of course the best place to find this is in the kidney. So here's an infarct, and the reason that we're seeing infarcts is because these Pseudoneoplastic lymphocytes are also attacking the media of arterioles and arteries. And here's the arcuate artery of the kidney with a tremendous vasculitis there that has resulted in this infarct. How are we going to control malignant catarrhal fever? Certainly the best way is to make sure that cattle do not have access to calving wildebeest or lambing sheep. Or once again, as Gary Larson says, what? Well, what have I always said? Sheep and cattle just don't mix. This is a painting called The Farm by Jean Miro, and I think it demonstrates the type of facility in which we're most likely to see malignant catarrhal fever. We're not going to see it in agribusiness locations. We're going to see it in locations where animals have opportunities to mix with other species. Next, we'll cover 3 foreign animal diseases that are respiratory in nature. And this lithograph by Edvard Munch, called The Scream, depicts the ease with which this next disease could come in and the concern that our regulatory authorities have about this disease. And that disease is heart water. Heart water is an acute tick-borne disease, and it's characterized by respiratory disturbances, namely pulmonary edema, hydrothorax, and also central nervous system disturbances. Heart water is caused by a rickettsia, a member of the tribe Ehrlichia, and the name of the organism is Cowdrea ruminantium. There are about 9 species of amblyoma ticks that will transmit heart water. One of the worst offenders is pictured here. This is amblyoma variegatum, male and female. Amblyoma ticks, African amblyoma ticks, tend to be quite large, and here's a group of amblyoma ticks on the dewlap of a cow to give you an idea of how large they are. Here are some that were picked off and held in the palm of someone's hand. Where does Cowdrea ruminantium occur? Well, it occurs wherever the amblyoma ticks are found in Africa. In addition, heat-resistant cattle were brought from Senegal to the Caribbean in the 1830s. It's thought that these cattle brought amblyoma variegatum with them. We know that amblyoma variegatum is present in about 17 islands in the Caribbean. We also know that heart water is present on at least 3 of those islands in the Caribbean. Now we're quite concerned because these amblyoma variegatum ticks in the Caribbean, many of them are infected. They're moving between islands, and mostly they're moving between islands on these cattle egrets. Now, some very sophisticated studies were done actually by the people at University of Georgia. They took cattle egrets on several islands in the Caribbean, and on some islands they painted one wing blue, and on other islands they painted that wing red, and then they tracked these animals, these birds, and they found that the cattle egrets traveled tremendous distances. We know that amblyoma variegatum often infests these cattle egrets, and the possibility, or rather probability, of one of these egrets showing up in southern Florida with an amblyoma tick on it is really very good. We also worry about amblyoma ticks coming in on reptiles. And we found this with increasing frequency in recent years. And actually, there's a group of imported tortoises in Florida where they found amblyoma ticks had become well established there, and by PCR those ticks were positive for Cowdrea ruminantium. So this is a big concern, and recently more restrictions have been imposed on especially the tortoises, movement, importation, and interstate movements of the tortoises. We know that the amblyoma ticks, which we have in the U.S., we have 3 species of amblyoma ticks. Of those 3 species, at least 2 would be very capable vectors of heart water. So all that would take would be for, say, a cattle egret to come into the U.S., the amblyoma tick to drop off, infect another animal, perhaps a white-tailed deer. That animal would become rickettemic. All of its amblyoma ticks would become infected. It would move off and it would spread in a geometric fashion. We have increasing concern because we now know that wildlife can be affected subclinically. We used to believe that once an animal was infected, it either died or it cleared the infection and it was permanently immune. That we know that's not true anymore. We know that animals can harbor the infection, and ticks at a certain stage of development can pull the infection out of a subclinically apparently recovered animal. We also know that Cowderia ruminantium can be transferred from dam to offspring, probably through the colostrum. So all of these recent findings have increased our anxiety about the introduction of heart water. Now, as I mentioned, recovered animals can carry heart water. These experiments have been done showing that a recovered animal carries heart water for quite a few days. The infection can be pulled out via the tick, transmitted to another animal. What does heart water look like? The clinical signs are often missed. Sometimes all you see is sudden death. When you do see clinical signs, they have a high fever, depressed, difficulty in breathing, and a variety of central nervous system signs. Here's a picture of a white-tailed deer showing open-mouthed breathing. A goat with torticollis. We see a wide variety of central nervous system signs because the underlying lesion is cerebral edema. So any part of the brain can be affected. We see everything from severe depression to head pressing to seizures, and as is seen here, torticollis. And often all that we find is an animal that's dead. And here's an African bovine that's dead. It's got had severe pulmonary edema when it died, as reflected by the froth at the nares. What do we see grossly? Grossly, we have the triad of thoracic lesions. We may see one of this triad, or two, or all three. And that triad includes severe pulmonary edema, hydrothorax, and hydropericardium. Cerebral edema is often found as demonstrated in this brain, where there's coning and herniation of the cerebellum through the foramen magnum and a slight bulging of the gyri. What do we see histologically? Well, most of the lesions are in the thorax. We see pulmonary edema, but there's not a lot of inflammation associated with the pulmonary edema. It's more a garden variety kind of pulmonary edema. The best place to make the diagnosis is to look at the brain. These Cowderia organisms, these rickettsias, tend to prefer to replicate in the endothelial capillaries of the brain, anywhere in the brain. So what we have is an endothelial cell here, and the cytoplasm is expanded by a group of Cowderia organisms together, and this group is referred to as a morula. Now, why do we get the lesions in the thorax? We see very few Cowderia organisms in the lung or in the heart. It's thought that the Cowderia organisms replicating in the brain are causing vascular compromise, cerebral edema. The cerebral edema comes on so quickly that it causes a brain-heart syndrome, and the lesions are a reflection of that. Neurogenic pulmonary edema. Very rarely do we see inflammation in the brain, and here's an example of that where we have a focus of gliosis right next to a capillary that was infected. Now, making the diagnosis can be very difficult because finding those morula in a histologic section is challenging. Often there's no inflammation present in the brain, and without going down on the slide to high power examining every vessel, it's very easy to miss. Also, many of these animals have no history of CNS signs, and all that's noted at postmortem are the pulmonary lesions, and so oftentimes the brain is examined only in a very cursory way or not at all. So it's quite easy to miss the diagnosis. Even if you are thinking of it and looking at the brain sections, it can be very painstaking to actually find a morula in the sections. So the best way to diagnose it is by making a brain smear. And to do this, you take a pea-sized section of brain, any part of the brain will do, macerate it thoroughly between two glass slides, and then pull it in a halting manner on a glass slide so that we are spreading out the neuropill, which has been largely macerated, and the capillaries are the last to go, so we're left with a meshwork of capillaries on the slide to examine. Staining it either with Giemsa or Diffquick will reveal Cowdrیا morula. So you get a large mass of capillaries to examine, and here are two capillaries, and here you can see a Cowdrیا morula, and there's another one, filling the cytoplasm of the endothelial cells. That's what we need to do to make a diagnosis. How are we going to control heart water? Well, certainly giving antibiotics will help. It's a rickettsia, so it's sensitive to tetracycline. However, you have to diagnose it in order to treat them, and usually the diagnosis is made post-mortem. If we got it in this country, it might be possible to treat all of our domestic livestock with anti-tick therapies, but certainly it would be in the wildlife, and there would be no way we could treat all of our white-tailed deer with acaricides. Probably depopulation is the best solution. There is a vaccine. It's made in South Africa. Unfortunately, it is a live suspension of Cowdrیا. Animals that are moved to a tick-infested area are given this vaccine, then they're monitored very closely. As soon as they spike a fever, they're treated with tetracycline. However, some animals are treated with tetracycline before they've experienced the full rickettsiemia, so they never develop immunity. They get it when they go into the area. And other animals die before the fever is really noticed. So there's about a 15% mortality associated with the vaccine. This is a disease of great concern for regulatory authorities in the U.S., primarily because of our wildlife population and how the disease could come in, get established in wildlife, then it would be impossible to eradicate. And here's an example of a white-tailed deer, and you can see virtually all white-tailed deer carry amblyomma ticks. The next disease that we'll cover, also a respiratory disease, is demonstrated by this bronze sculpture from Benin, an area in West Africa. And as you can see, this zebu cow is having a lot of difficulty breathing. The disease that we'll cover now is contagious bovine pleuropneumonia. To give you a little history about contagious bovine pleuropneumonia, it is an ancient disease. It was brought to the U.S. in 1843. It was taken into the area around Brooklyn, which then had some dairy farms in it. It came from England. From this area in the eastern U.S., from the New York area, it spread all over the eastern seaboard and as far west as Ohio. There was great concern because in the early 1880s, other countries embargoed our animals and animal products because we had contagious bovine pleuropneumonia. So even though we got it from England, they wouldn't buy any products from us. As a result, the U.S. formed the Bureau of Animal Industries, which is the forerunner of the USDA regulatory agency for animal diseases. The Bureau of Animal Industry was headed up by Daniel Salmon of Salmonella fame, and his first job was to eradicate contagious bovine pleuropneumonia. So over the course of the next 8 years, he and some of his colleagues went and they visited a lot of places where they were slaughtering animals, where they saw these lesions that were typical of pleuropneumonia. They would then go back to the farms, do rudimentary tracebacks, chase animals down the laneway. Those that lagged behind were killed, and eventually they eradicated the disease. This is amazing because they did this before they even knew the causative agent. So he was eradicated in 1892, and it wasn't until 1898 that Nocard in France first cultured the pleuropneumonia organism. This is a subacute to chronic disease of cattle. It's a pneumonia, pleuritis, and it's caused by a mycoplasma. The mycoplasma that causes this disease is really a mouthful. Mycoplasma mycoides, subspecies mycoides, small colony type. Unfortunately, you have to say the whole thing because this is the agent of contagious bovine pleuropneumonia. Mycoplasma mycoides, subspecies mycoides, large colony type, is found all over the world. It's even found in the U.S., and it causes a polyarthritis septicemia in goats, especially goat kids. How is contagious bovine pleuropneumonia transmitted? It requires fairly close contact. Basically, droplets containing the organism have to be coughed from the lung of cow A, come out the mouth, and land in the respiratory tract of cow B. The host range is quite narrow. Cattle suffer the severe form of contagious bovine pleuropneumonia. Water buffalo are occasionally infected. Has a very long incubation period, which makes epidemiologic tracking difficult. Morbidity and mortality are variable. It depends upon the husbandry conditions, how close the animals are, and any intercurrent stresses. Clinically, what we see, animals are coughing, they have respiratory distress, they can get emaciated if it goes on long enough, and they often have some stiffness because this mycoplasma will also go to the joints. So here's an infected animal. These animals are coughing, they have a lot of crud in their airways, and when they die, it's a pneumonia like it's really severe. So here we have tremendous amounts of fibrin on the pleura. And once again, or as they sometimes say, omelets of fibrin. It can be a milder disease as well, and it usually starts in one location. So when it's a milder disease, it is often fairly localized. And because of this localization nature, it's often unilateral as well. It's thought that the pleuropneumonia gets down into one side or the other of the lung. It's a slow-growing organism. It takes a while to engender its lesions. And by the time the lesions are full-fledged and organisms can be coughed up and drop down the other side of the lung, that there's enough immunity on the other side to keep a small group from becoming established. The biggest rule out for contagious bovine pleuropneumonia is shipping fever. Now there are many people that say, well, contagious bovine pleuropneumonia is always unilateral and shipping fever is always bilateral. You can never say never, because here's an example of bovine pasteurellosis or shipping fever that's unilateral. A very characteristic feature of pleuropneumonia is what's seen on cut section, and this is marbling. There tends to be distinct separation of the septa and filling with fibrin. This organism produces a toxin, a part of the cell wall. It's called galactan. This is unique among the mycoplasmas. And this galactan is very necrotizing and stimulates a massive outpouring of fibrin, creating this characteristic marbling appearance. As I mentioned, this mycoplasma will also go to the joints. Animals can be quite stiff, and here's an example of arthritis. And in that joint, we found big wads of fibrin. Occasionally, multiple joints will be affected. This particular animal was showing central nervous system signs, which was quite a mystery to us until we found that it had fibrinous arthritis at the atlanto-occipital articulation. Another characteristic feature of contagious bovine pleuropneumonia, in addition to the marbling, is that this disease has a tendency to form pulmonary sequestra. So what we get here is an area of dead lung. This creates a big problem in transmission of the disease, in that the animal may recover from contagious bovine pleuropneumonia, but this sequestrum remains in the lung, it remains avascular, and there may be a good nidus of pleuropneumonia there. Then what happens, the animal is taken to a new herd, somehow the infection flares up, the mycoplasma moves out of the dead area, gets coughed up, and you get an outbreak in a new herd. So this is the typhoid Mary of the pleuropneumonia story. So we need to remember that recovery does not necessarily mean that the animal is no longer infected. How to control contagious bovine pleuropneumonia. It's always been well controlled through slaughter. That worked very well in the last century. The lesions are so highly characteristic that it's quite possible to identify infected animals visually at slaughter. Treatment, it is susceptible to antibiotics, but the problem is that antibiotics may hasten recovery, and recoveries can be associated with sequestra. There is a vaccine for contagious bovine pleuropneumonia. It's used in Africa, but it has some drawbacks. In general, it's given in the tail tip. Now remember that this organism has a toxin that's extremely necrotizing. The toxin is also present in the vaccine, so in general the vaccine is given in the tail tip so that if there's an area that's going to slough, the animal will not lose a lot of function. Here's an example of a vaccine given subcutaneously in the neck, and see there's a large area of necrosis. It's developed a big abscess. Now we'll move on to the third respiratory foreign animal disease that we'll cover. And this is a bit of art by a Spanish painter, which is very fitting for talking about this disease. And this is a painting by Pablo Picasso. The disease that we're going to talk about next is African horse sickness. Here's a definition of African horse sickness. It's a disease with high mortality, carried by insects, and affects horses and their cousins. The etiology is an orbivirus, part of the family Reoviridae. Horses are infected with and suffer an often fatal form of the disease. On the other end of the spectrum, zebras tend to suffer subclinical disease. They can be infected and viremic for as long as 6 or 7 weeks with no clinical signs. In between, we have donkeys and mules. We may see mild disease in donkeys, perhaps a little more severe in mules. We do know that dogs can be infected with and suffer lesions of African horse sickness when they feed on carcasses of horses that have died of African horse sickness. Here's the insect vector. This is a culicoides insect, otherwise known as no-see-ums, gnats, midges. And these, as you can see, are blood feeders. And here they are feeding on the arm of a very dedicated entomologist. African horse sickness exists in Africa wherever the culicoides exist. So it's the dry tropical zones on either side of the equator. African horse sickness has always been confined to the African continent with a few exceptions. There was a spread up to the Middle East in the 1960s. In 1987, African horse sickness was taken in zebras from Namibia, West Africa, up to Spain, caused an outbreak in Spain that lasted over 4 years. African horse sickness clinically, sometimes animals are just found dead. Occasionally, or more often, they have some form of respiratory distress. There might just be signs of colic. And a characteristic feature when it occurs is this supraorbital edema. However, the supraorbital edema probably only occurs in about 10% of the cases. Here's an example of a horse with supraorbital edema. Normally, this fossa is a fossa, it's depressed, and some animals, when they're infected with African horse sickness, this fat pad in here bulges. It's probably bulging due to the heart failure that's happening and the altered hemodynamics in the cranial end of the animal. There can also be conjunctival edema, injected sclera, congested mucosa. And as I mentioned, sometimes animals are just found dead, froth exuding from the nares indicating pulmonary edema. Now, some animals may just show signs of colic and then be found dead. What we see at postmortem, now often we see very few lesions at postmortem, so there's a wide range in what is seen with African horse sickness. Here's an example of an animal that died with severe pulmonary edema, and there's tremendous edema and also hydrothorax. Hydropericardium is also seen in quite a few cases. Once again, in this animal, you can see that there's very little pulmonary edema. The myocardium is affected. Sometimes it's only affected histologically. Occasionally, you can see foci of hemorrhage within the papillary muscle of the left ventricle. The best place to look for postmortem lesions associated with African horse sickness is in the muscle bundles around the ligamentum nuchae. So here's the ligamentum nuchae. The animal's head would be over here. If you reflect these muscles back, you're likely to see a collection of edema here. But I can guarantee you that this is an area that is not examined in any routine necropsy of horses. This is a striking case with a lot of edema. Sometimes in an animal that dies of African horse sickness, all you find is a milder form of this edema seen here, and that might be all that's present in the carcass grossly. So how are we going to diagnose it histologically? Well, once again, histologically there is nothing that's really very characteristic. You get some edema of the adventitia of the vessels, not unlike what other orbiviruses will do, and of course pulmonary edema, but there are no inclusions, no characteristic lesions. Using in situ hybridization or immunohistochemistry, the blood vessels throughout the lung are affected. And so here we have staining of endothelial cells. It's also been shown that the pulmonary intravascular macrophages in African horse sickness are infected, and it's probably the release of cytokines from those cells that enhances the pulmonary edema. Within the muscle bundles of the neck and also in the heart, we see staining of endothelial cells there. So that's what's causing the edema and hemorrhage in those locations. As I mentioned earlier, there was an outbreak of African horse sickness in Spain in the late 80s that lasted through 1991. Zebras were taken from Namibia and transported through Portugal to a safari park near Madrid, which is in central Spain. Unbeknownst to anyone, those zebras were having a viremia of African horse sickness. Something like 60 horses died before they tumbled to the conclusion of African horse sickness, which I think only underscores the difficulty with which it is to make a diagnosis of African horse sickness if you're not already thinking of it. African horse sickness, they tried hard to control it. This is Rafael Bolivar, who was head of animal health in the part of Spain where African horse sickness occurred. He undertook, I thought, fairly draconian measures to contain African horse sickness. He was not able to contain it, and I think the rest of the world learned a lesson as to how easily this disease could spread and what a nightmare it is for regulatory authorities. Spain is now free of African horse sickness. So how would we control it here? Certainly vector control is very important. We have to keep the population of culicoides down if we want to prevent the spread of disease. Test and slaughter would be implemented, which is obviously going to be very difficult when dealing with equine populations, and vaccination. Since the outbreaks happened in Spain, there is an improved vaccine that would be used in the event of an outbreak. The next two diseases that we'll talk about are those foreign animal diseases that affect poultry. I think sometimes we tend to forget poultry when we're dealing with animal diseases, but in fact poultry is our largest agricultural export. The U.S. poultry industry, in terms of gate receipts annually, takes in $21 billion. 2.5 million tons of poultry go for export every year. And with our increasingly healthy poultry industry, the export market has continued to take a larger share. What this means is that if we have an outbreak of a poultry disease that keeps us from exporting, that share of the market collapses, the domestic market gets glutted, and the poultry industry goes completely belly up. We need to safeguard our poultry against these foreign diseases, and the first disease we'll talk about is Newcastle disease. This is caused by Newcastle disease virus, which has recently been reclassified into the genus Reoviridae, part of the family Paramyxoviridae. Now, Newcastle disease unfortunately has its own confusing terminology, so I think it's worth just a moment going over this. Here are 3 terms that are used to describe Newcastle. You won't find any of these terms in a dictionary anywhere. These are the three pathotypes of Newcastle disease. When a virus is isolated, it's inoculated into embryos. If the embryos survive more than 90 hours, it's called a lentogenic isolate. If the embryos die in less than 60 hours, it's called a velogenic isolate. Now, some of these lentogenic viruses are constantly circulating, and these are the source of our vaccines. The velogenic isolates are the ones we worry about as far as foreign animal diseases. Newcastle disease tends to be a major limiting disease of poultry all over the world. We keep these velogenic strains exotic to the United States. The last outbreak of velogenic Newcastle disease occurred in Southern California in 1971. It cost $56 million to eradicate. Okay, how did that outbreak happen? There were some smuggled birds that came in, were sold to a woman who she had them in a cage in her home. She thought they didn't look very good, so she decided that they needed some exposure to fresh air. She let them loose. They were carrying Newcastle, and it was taken to many areas around there, and a full-scale eradication effort was launched to get rid of it. The disease we particularly worry about is viscerotropic velogenic. And in this virus, it's viscerotropic, so we tend to see a lot of intestinal lesions. We have found that there's a distinct tropism for macrophages. Velogenic viscerotropic Newcastle disease will kill birds in 48 to 72 hours. This is what they look like when they're infected. They may have a conjunctivitis. They're quite depressed. They show some CNS signs. Here's a bird with torticollis, and they have diarrhea. Then they're found dead. What we see pathologically is we see some intestinal hemorrhage. We see splenic necrosis. We see hemorrhage in the proventriculus. Histologically, the macrophages are wiped out. Here's the spleen from an infected bird, and all of the macrophage areas are just plain empty. Early in infection, this is in situ hybridization, showing that the virus is in macrophages. It comes in this way, it circulates this way. Similarly with the cecal tonsil, which is the lymphoid area in the chicken gut. It comes in via the macrophages and seems to get passed off to the epithelium. In the myocardium, there are clusters of macrophages that are infected, and infection of the cardiac myofibers. In the brain, we see a lot of gliosis, perivascular cuffs, and groups of neurons have positivity. Newcastle disease occurs all over the world. There's an outbreak happening in Mexico right now, the summer of 2000. Earlier in the year, we had problems in other parts of the world. Australia had it, broke out 2 years ago. They spent $30 million trying to control the disease. And in March of this year, March of 2000, the authorities declared this disease is not eradicable. We had this disease in Fresno in 1997. It was found in a group of fighting gamecocks in downtown Fresno. Fortunately, the California Department of Agriculture had good relations with these people. They reported their sick birds. They eradicated the disease by killing all those gamecocks that were presumably smuggled into the country, and the poultry industry was not affected. Nevertheless, since we had to declare that we had viscerotropic velogenic Newcastle disease, Russia would not buy any of our poultry products, and we lost $400 million in trade. A very important disease. Sylvia Judson Shaw, the bird girl. The next disease that we'll talk about is avian influenza, specifically highly pathogenic avian influenza, the other List A disease of poultry. Highly pathogenic avian influenza is caused by a virus that's in the family Orthomyxoviridae. Now, what's characteristic of all of the influenza viruses is that they have these two envelope glycoproteins, hemagglutinin and neuraminidase. One allows for attachment and one allows for infection. There are several types. They're all numbered, H or N. All of the viruses that affect birds are H5 or H7. H1, 2, and 3 were previously thought to be the only hemagglutinin types that infected humans. Highly pathogenic avian influenza refers to those strains of avian influenza that cause high mortality in chickens, and as I mentioned, all high-path AI are H5 or H7. It's spread by droplet transmission, airborne transmission, and anywhere where you have ducks, migratory waterfowl, you could well have highly pathogenic avian influenza waiting to come out. What does it look like clinically? These animals are quite depressed with ruffled feathers. They may have diarrhea, but probably the most characteristic feature are these swollen combs and wattles, as depicted here. Tremendous amount of sub-Q edema, which has expanded the wattles. There's also edema in the comb. Shank hemorrhage is seen on quite a few birds as well. Sometimes the first thing we see is just dead birds. Grossly subcutaneous edema, petechial hemorrhages. The pathogenesis of this disease involves infection of endothelium. So here's an open subcutaneous area of a chicken infected with highly pathogenic avian influenza, and there's quite a bit of sub-Q edema evident here. Petechiation can be found anywhere. Remember, this is a disease of the vasculature. Widespread infection of capillary endothelium, and in some areas the virus spills over from the capillaries to involve the parenchyma. This happens especially in the heart and the brain. Here's a section of wattles early in infection, and you can see that there's tremendous infection of the endothelium. This is immunohistochemistry. Then a couple days later, it's spilled out of the endothelium, and it's in the surrounding area, and this is what gives you all the edema that's seen there. Heart, infection of cardiac myocytes, spills out and infects the muscle cells. This is not a lymphotropic virus, as are some less virulent avian influenza virus, but rather it's a section of spleen, and the virus is confined to endothelium. Highly pathogenic avian influenza was our last major foreign animal disease outbreak in the United States. It happened in 1983, and it's thought that this was a virus that came from a duck that underwent a mutation, spread among poultry, and caused tremendous losses. There were 17 million birds killed in Pennsylvania, Delaware, and Maryland to control this disease. It cost $63 million to eradicate this disease, and early on there was some debate as to whether or not the disease should be eradicated. They brought in the economists who said, well, if you don't eradicate it, it's going to cost about another $350 million per year in what people will have to pay for their food. So there was absolutely no more hesitation, and they went in and eradicated the disease. Highly pathogenic avian influenza continues to cause problems around the world. In Italy of this year, February of 2000, they had an outbreak. They controlled 6 million birds. In Mexico in 1998, they had an outbreak, killed millions of birds. And in Central America, it's still smoldering there. Avian influenza made headlines a few years ago, and it broke out in Hong Kong. There were problems in Hong Kong, and then to everyone's surprise, this avian influenza, which was H5N1, spread to humans. There were 18 people, all of whom got the disease, got the virus from chickens. There was no human-to-human spread. And of those 18 cases, 6 died. Everyone was very surprised because this was H5N1, and previously only H1, H2, and H3 were thought to infect humans. They slaughtered all of the chickens in Hong Kong to control this disease. And hopefully it has been eradicated from Hong Kong now. That's John James Audubon painting of the brown thrasher, which is the state bird of Georgia. And from there, we'll move into the final disease that we're going to cover, a disease that's actually very timely because it did break out in the U.S. earlier this year, and this is viral hemorrhagic disease of rabbits. Once again, John James Audubon, his painting of rabbits. Here's a definition. It's a paracute disease. Sometimes these animals are dead in 36 hours. And they're dying because they have massive hepatic necrosis and a terminal DIC. Viral hemorrhagic disease was first seen in China in 1984. They lost essentially their entire population of laboratory rabbits. It's caused by a calicivirus. How did it start? No one knows for sure, but it's related to European brown hair syndrome virus. And it may be that the European brown hair syndrome virus somehow was inoculated into a rabbit, became adapted for rabbits, virulent for rabbits, and spreads among them. As I mentioned, animals are often dead within 48 hours. Transmission is fecal-oral, and the virus can survive for a little while in feces, so there's a problem with environmental contamination. The most consistent clinical sign is death. Often we don't notice the animals are sick, they're just dead. Sometimes because of the DIC, they have terminal epistaxis. Pathologically, this is what we see. Hepatic necrosis and disseminated intravascular coagulation. So here's a normal liver, normal mahogany color of a rabbit liver. And here's a rabbit that is infected with viral hemorrhagic disease of rabbits. Tremendous necrosis. It's intensely mottled. Histologically, not a lot of inflammation, but there is distinct necrosis. A low power view of the liver, higher power view of the liver with individual necrotic cells. There is a terminal disseminated intravascular coagulation, and here's a renal glomerulus filled with fibrin thrombi. We also get fibrin thrombi in larger vessels, and here's a pulmonary vessel with a big thrombus. Who gets viral hemorrhagic disease? It's a disease of rabbits. But what kinds of rabbits? The Eryctolagus rabbit is the old world rabbit, and this is the rabbit that is wild in the old world and is also the rabbit that became domesticated. So all of our domestic rabbits here are Eryctolagus. All of the wild rabbits in Europe and Asia are Eryctolagus. Silvolagus, these are the cotton-tailed rabbits. These are our wild rabbits here, cottontails. And then this is the hare genus. So the Eryctolagus species is susceptible, but our cottontails and hares are not susceptible. And here's a picture of a hare. What other species are susceptible? These are bilbies, which is a marsupial found in Australia and New Zealand. Bilbies, and in these countries they're making a big fuss over bilbies, not bunnies. As you may be aware, Eryctolagus rabbits were introduced into Australia and New Zealand in 1843, and they have become very prolific, populating as well as they do there. And it's estimated that 7 rabbits eat as much as 1 sheep. So people are really eager to get rid of the rabbits. They want to promote the bilbies, not the bunnies. Viral hemorrhagic disease of rabbits was examined by the Australians as a possible biological tool for getting rid of their rabbits. So they got the virus and they brought it to their high containment facility in Geelong and did all of the studies on native marsupials to make sure that none of these animals were infectable. Then they began some field trials. They started these field trials on Wardang Island, which is an island about 2 kilometers off the coast of South Australia. They had rabbits in outdoor pens. They gave them the virus. They noticed that the rabbits in the pens were dying. Then they noticed that the rabbits outside the pens were dying. But they weren't too concerned because they knew they were on an island. They knew that it probably wouldn't escape further, but it did. Before too long, there were cases in South Australia, and after that, it just leapfrogged all over the country. It's thought that what happened once news reached farmers that it was present on the mainland, they went down there, picked up dead rabbit carcasses, and took them back to their farms to speed the spread of the disease. The control of rabbits via this virus has met with mixed results in Australia. In some parts, it's been very effective, and in other parts, the rabbits are still doing quite well. They've looked at the virus after it's been in the wild for 2 years, and they found that there is minimal genetic variation, so they feel quite secure that they're not going to have further problems with this virus. But that brings us to the situation that happened in New Zealand. The people in New Zealand liked the farmers in New Zealand liked what they saw in Australia so much that they petitioned the government to let the virus into New Zealand. The New Zealand government said, no, we're not going to do that. We're worried. We have a lot of flightless birds here, and if we bring in this virus and kill all the rabbits, then what will the ferrets eat? They have imported ferrets and stoats, and they were afraid that without rabbits, some of these imported predators would then feed on the flightless birds and push them over the brink of extinction. The farmers weren't very happy about that, so they took matters into their own hands, and in August of '97 they imported the virus into Australia. Interestingly, the virus was intercepted 12 times at the border, known interceptions, prior to it actually coming in. And the way it came in was that they took the virus, they put it onto a handkerchief, and it's fairly stable, so once the handkerchief was dry, it was stable. Someone brought it in their pocket, and then they rinsed it out in the sink, made a slurry, put it into a rabbit. When the rabbit died, they took the liver out of the rabbit, ground it up in the blender in the kitchen, and spread it around that way. It was widely distributed. This has been very controversial in New Zealand. It's been successful in killing an awful lot of the rabbits, and the government has decided that they're not going to prosecute any of the people who brought this virus in. This slide is a list of all of the cases of agro-warfare, agro-terrorism against animals that have happened in this century. And you can see all of these had to do with civil strife or war, with the exception of this last one, which was the New Zealand farmers bringing in the rabbit hemorrhagic disease. And I think this is a reflection of the future shock world that we live in. If New Zealand sheep farmers are going to perpetrate agro-terrorism, I think we can expect just about anything. The outbreak that happened this year was in Denison, Iowa. It was in a group of 4-H rabbits, so it's in the middle of Iowa. They had 25 of the 27 rabbits at this one location died. It was a closed premise. The owner claims that no animals had been on or off for the last 2 years. They looked at the isolate, and the isolate is actually closely related to European strains. Viral hemorrhagic disease of rabbits was present in Mexico in the late 1980s, and at first it was thought, well, maybe it's remaining there and a migratory bird brought it in. But in fact, this isolate from Iowa somehow came here from Europe. No one knows how it came in. But once again, if a foreign animal disease can show up in the middle of Iowa, we can expect the unexpected. As this slide demonstrates, we're living in an era of future shock, tremendous global traffic of people and animals, and we need to always keep in mind that anything can happen. This is a painting by someone who's more famous for his soup cans. This is a painting by Andy Warhol, and I'd like to remind you that Andy Warhol says everybody's famous for 15 minutes. Well, as you're well aware, there are 2 ways to become famous with a foreign animal disease. One is to miss it, and one is to diagnose it. So let's try and be in the latter category, so that when we hear hoofbeats on the covered bridge, we need to be thinking about the zebras. Thank you.